My name is Stacy Silvers. I'm an otolaryngologist. I've been in practice for 18 years. My specialty is sinus surgery, and I've tried to gear my practice more towards in-office, minimally invasive surgery, which is where the balloon sinus procedures really come into play.
I have had sinus problems my whole life. I'm always stuffy. I always sound nasally. I had tubes when I was a kid. I had ear infections my whole life. And then with now, I didn't really have allergies, but as they developed, it just got worse and worse after college. And now I get a sinus infection probably once every couple months. And over Christmas, I had double ear infections. And I was like, all right, now I need to do something because it's just, my quality of life is not as high. But I never really thought that I wanted to have anything that was very invasive. A coworker recommended Dr. Silvers to me. Everybody in our office loves her, so I came over just to kind of see what the process was and what she thought we should do.
Hi, good afternoon.
Good afternoon.
You have an appointment today?
I do.
Okay, just sign in for me, please.
So there are three key factors that I focus on when it comes to choosing the ideal in-office patient. The first is that I need a patient who can handle me going in and out of their nose. They can't be generally squeamish or anxious, but fairly comfortable and confident with scopes in the nose and procedures in the nose. The second thing that's important is that their physical exam allows me to access the doors of the sinuses. If they have a very deviated septum, it will be very difficult to do it in office, and those are patients that I would choose probably not to do under local anesthesia. The third factor is the CAT scan. When I look at the CAT scan, I'm really focusing on the middle turbinate, which I think is a key to being able to get into the middle meatus, access the frontal and the maxillary openings. If there's a very large concha bullosa or the middle turbinate bone is very, very thick, then generally the patient may feel a little bit more discomfort in doing an in-office procedure, and I might also choose to do that patient in an OR setting. If the patient has a lot of polyp disease, there's a higher risk of bleeding. That's something I would notice, of course, on the physical exam, as well as the CAT scan, and we would then probably choose to do that in an OR setting. I started using the NuVent fusion system about 3 years ago. I was introduced to it by the rep from the company, and I love the new and advanced technology. I like to keep up with the technology with the balloon dilation procedure. I had been very comfortable using the Medtronic fusion system and have used it for many, many, many years. The addition of the NuVent balloon to a system I was already quite comfortable with it was a very natural progression. My favorite thing to do is to make a patient better and discharge them from my care.